Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Diclofenac. Its brand name is Voltaren. Before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Diclofenac is classified as a non-steroidal anti-inflammatory drug, or an NSAID. It's in the same class of medication as ibuprofen or Advil. This medication works by inhibiting prostaglandin synthesis. In terms of indications for use, it can be used to treat mild to moderate acute pain. It can also be used for moderate to severe pain with or without the use of narcotics. Following a refractive keratoplasty, it can be used to treat pain in the eye. It can be used in rheumatoid as well as osteoarthritis. It's indicated to be used in the treatment of ankylosing spondylitis. And finally, actinic keratosis can also be treated with Diclofenac. Now, before somebody was to use Diclofenac or Voltaren, there are some contraindications they must clear, as well as some precautions and warnings that they should be made aware of. This medication would be contraindicated in patients who have had asthma, urticaria, or allergic-like reactions in the past when taking an NSAID. It cannot be used for perioperative pain after a CABG surgery or coronary artery bypass graft surgery. If a patient had a hypersensitivity to Diclofenac or any other component of the product, they would not be able to use this medication. And finally, it would be contraindicated in patients who have mild or severe renal impairment and are at risk for volume depletion during a perioperative period. Now, in terms of precautions, Diclofenac is on the Beers criteria, which is a list of medications that the elderly population should either avoid or use cautiously. This population would be at an increased risk of gastrointestinal bleeds and peptic ulcers through using this medication. However, in some situations, if other alternative medications to treat pain are not appropriate for the patient, and they are able to take a gastroprotective agent, such as a proton pump inhibitor, then they could try to use Diclofenac. Patients should be made aware that NSAIDs may increase their risk of having a serious cardiovascular thrombotic event. For this reason and some others, we always try to use the lowest possible dose for the shortest duration of time. Patients may be at an increased risk of reinfarction while using NSAIDs if they have had a myocardial infarction or heart attack in the past. Patients should be made aware that there's an increased risk of heart failure while using NSAIDs. New onset or worsening of hypertension or high blood pressure may occur with the use of this medication. Fluid retention or edema has been reported. This would be a concern for patients who have heart failure. Patients should be made aware that the use of aspirin and other NSAIDs is not recommended while using Diclofenac. If somebody is using topical Voltaren, they should be made aware not to apply to open wounds. Some serious skin reactions have been reported, such as exfoliative dermatitis, as well as Stevens-Johnson syndrome. Some patients may experience a prolonged bleeding time. Patients with coagulation disorders would be at an increased risk of experiencing this. Some patients using Diclofenac have experienced hepatic reactions, such as elevations in their transaminases or jaundice. The use of Diclofenac is not recommended in patients who have moderate to severe hepatic impairment. Inflammation and fever may be masked with the use of Diclofenac, and this could make it difficult to diagnose some infections. The use of Diclofenac is not recommended in patients who have moderate to severe renal impairment. And finally, this medication should not be used during pregnancy. Now, when somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Diclofenac or Voltaren, they can expect to take their dose in tablet form or to use a topical cream. When somebody is using the delayed release enteric-coated tablets to treat their rheumatoid arthritis, they would typically use 150 or 200 milligrams daily in 2 or 4 divided doses. Somebody in this same situation but using extended release tablets could use 100 milligrams once daily, and then if tolerated and if needed, they could increase to 100 milligrams twice daily. If somebody is treating ankylosing spondylitis, they could use 25 milligrams 4 times daily with an extra dose at bedtime if required. For osteoarthritis, using the delayed release tablets, they may use 150 to 200 milligrams daily in 2 or 3 divided doses. They may use a topical 1% gel that will be applied 4 times daily, or a 1.5% solution in which they would use 40 drops on the affected area. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Diclofenac or Voltaren, so I'll go over some of those here now. 84% of patients that do use the topical version of Diclofenac do experience an application site reaction. Some patients may experience a blood coagulation disorder. 15% of patients that use the eye drops notice a burning sensation in their eye. Some more rare but serious side effects would be those cutaneous reactions that I mentioned, such as exfoliative dermatitis and Stevens-Johnson syndrome, a granulocytosis, liver failure, congestive heart failure, hypertension, or anaphylaxis. That's all we're going to talk about today with Diclofenac or Voltaren. As always, I'm thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.